Hello and welcome back to ALECtv. I'm your host Matt Fisher, coming to you from our annual meeting here in Salt Lake City. And joining me now from the state of Kansas is Senator Beverly Gossage. Senator, excuse me, welcome to the program. How's it going?
Fine, thank you.
Awesome. So what brings you here to our annual meeting for ALEC this year?
Interesting you should ask. I've been to ALEC many times, but as a speaker.
Awesome.
This is the first time I've ever come as a legislator.
That's awesome.
So it's been fun to kind of be on the other side.
Awesome. So you are involved in a lot of different issues for your district and your constituents. You deliver results. What's a key issue for you want to talk about today that you think needs to be discussed, especially in light of where we are as a country?
Well, number one for me is healthcare reform.
Awesome.
I worked with President Bush to help create health savings accounts. Worked with the Trump administration on looking at healthcare reform, but primarily because I've been a health insurance agent for 18 years. Former elementary school teacher. I became the district manager for Sylvan Learning Centers because I have 4 children, all in the gifted program except my youngest son who was severely dyslexic. So I homeschooled him.
Awesome.
And during that time, my family's typical small business owners. My mom and dad started a plumbing company 48 years ago. And one day Mother came to me and just said, here's all of our insurance stuff. Could you help me figure out? And you're just like, well, you know, I'll do my best, Mom. And when I began looking into small group health insurance, I thought, somebody needs to do something about this. Well, when you're from rural Kansas and somebody needs to do something means pull up your sleeves and get busy.
Absolutely.
So I got my license as an agent to start helping small businesses, and they asked me to speak at the local chamber. And then that led to the Kansas Chamber and the NFIB and the SBA, and being led to President Bush inviting me to the White House saying, can you help us figure out how to do this? So I've never been a government employee, I've never been paid, I've never been a lobbyist, just a concerned citizen that what government was trying to do was making things worse than better.
Gotcha. So, you know, oftentimes talk about healthcare in the context of thinking it's this broad national thing, but it's very different, especially for rural Americans. You know, hospitals are often the only resource they have, which hospital bills are much higher than a clinic bill or whatnot. What are some of the ideas that you think that should be implemented for each state to help reduce healthcare costs for Americans, not just in the high population dense areas, but in states like Kansas and states like Nebraska, the Midwest, the Rust Belt? What are some ideas to help get us across the finish line in terms of affordable healthcare?
Good question. First of all, we need to know that each state has a Department of Insurance. I ran for insurance commissioner in 2014, came in second in a very busy primary. I filled a 5. It was a really good experience to go to 105 counties. I was born in Kansas, to meet with everybody and listen to what all their concerns are. I'm also licensed to write policies in about half the states. So you learn to know each state is different. They each have their own Department of Insurance, their different rules and regulations. The fewer rules and regulations they have, the lower the premiums were for health insurance. So health insurance should be like auto insurance or home insurance, in that it should be a very small piece. In fact, most of the time you should never really use it. Why is that? You don't wake up every day saying, I sure hope I can use my homeowner's insurance this month or this year, or my auto insurance. You try not to use it, right? That should be a small part. It's only going to cover the big stuff. So we've always in the past had catastrophic health insurance. You pay for everything else yourself. If you have some big catastrophic event, that's when you want insurance to step in.
Something where a retirement fund or a college savings account might get drained if it isn't covered.
Exactly. So you just want that to be a small premium because it's only going to cover big stuff. And it has morphed into prepaid healthcare. Well, insurance controls your life. It has taken over the budget of the United States as well as many of the state budgets. And so people actually have less access to care than they did before, when they could just go to their doctor, pay their doctor directly. We negotiate on what the price is, and they're like, fine with me because I don't have to have 5 people who are going to file health insurance premiums, or Medicare, or Medicaid, or name one. Instead, they just had to have a nurse or 2, and then that's all you pay as you go out, $25. They used to come to your home. By putting them into insurance, now they are regulated by insurance, the premiums and the cost of your care, which is where most people get their care, is at their primary care physician.
Right.
So we do see direct primary care coming back into vogue, of saying, we're not going to take insurance, just deal with us directly. Or your whole family can come for $50 a month. and we'll make sure we take care of you. So pleased to see that happen. So now I'm saying that to answer your question. I'm a conservative. The best thing I can say, and because I know what I've seen, is for government to get out of this.
Right.
Local control on the state level is what we have always had over private health insurance until the ACA, Affordable Care Act, commonly called Obamacare.
Obamacare, yeah. That's awesome. So what are some ways state lawmakers right off the bat can begin to move the ball downfield? If you were to talk to a lawmaker right now who's watching this at home, what would you tell them right off the bat are one or two policy reforms that they can immediately implement and pass into law to help reduce healthcare costs, help decentralize it, make it more local, make it more patient-physician instead of government or insurance company? What are some ways they can do that?
All right. There's a bill that I introduced just this past year, and it's one sentence. I like very short bills that get right to the point, right?
Right.
And that bill was regarding short-term medical plans. So because of the ACA, every state's individual market, now you have people who have employer-sponsored health insurance, right? But in the individual market, they're self-employed, their employer doesn't offer it, they're with a small company, can't begin to afford that. They buy their own private plan. They used to be very inexpensive in our state. Children's policies were $25 all day. We had 17 carriers to pick from, much like auto insurance. Now, if you're lucky, in your area you might have 3. In some areas there might be 4 carriers that you can buy from. They're all extremely expensive plans unless you can get a subsidy. So if you have a lower income, you can get a subsidy. What about middle income people?
Right.
They don't get a subsidy. Many of them are going uninsured because they just cannot afford those premiums. I'm talking between $300 and $500, depending on if you're 30 to 50 years old. If you are over 55, you're looking at $600 to $1,200, depending on the plan you select. Right. So it's extremely expensive. Short-term medical plans have been around for decades. They actually save you about 70% on your premium. They're not subject to the ACA, so it's like don't pay for what you don't need. So people are like, I really don't need maternity. That's a good thing, and this doesn't cover that. I can say I really don't want chiropractic. I'll pay my chiropractor, he's $25. So you have things that are excluded from these plans. They don't cover pre-existing conditions. That's important because a lot of people are like, I really don't have anything.
Right.
I don't want it to do that because I know it's going to be a lot more expensive. Let's just pay for things going forward. It is limited by 12 months. That's the name short term. Under the Obama administration, they dropped that down to 90 days. It's now gone back to 12 months. Under the Trump administration, it was set to 3 years. So it works like this. Buy a plan for 12 months, then you can buy another plan for 12 months. It's not just a continuous plan. You can buy another 12. Okay, the way it is currently in my state and most states, it's still that 12 months. So if you buy something and you develop something in that first 12 months, the next 12 months that you purchase, that thing you developed is not covered. The next 12 months, it's not covered. So what this does is just adopt the federal regulation that says anything that happened in that first month, 12 months, will be covered in the next 12, and we will be covered in the next 12. And they tell you the premiums up front. So you know what my first year is going to cost, the second year, the third year. I also know I can drop it any day. I don't have to take it for the full 3 months, for 3 years. It helps if you care about people with pre-existing conditions. It actually is going to give them a longer period of time to have a condition covered, treated before going on. Simple bill makes sense, right?
Flexibility, transparency, lowers costs. Well, Senator Gossage, thank you so much for joining us today on ALECtv. Thank you, it's been a pleasure. Thank you so much. And thank you to our listeners and viewers for tuning in to ALECtv. Be sure to stay tuned for more here from our annual meeting in Salt Lake City.